Yeah, hi everyone. Welcome to my channel. I do understand that so many medical students are following up my teaching when it comes to diabetes. So, our topic for today is diabetes and constipation. What is the connection? Once more, my name is Dr. WAN, and I am a certified diabetic educator, and I'm here to treat this topic. Please like my channel, subscribe to my YouTube, and share the links with other medical students. Constipation is a common complication in people with diabetes. Learn why and what you can do to relieve it. Living with diabetes means paying careful attention to all systems of your body. Some complications of diabetes are easily avoided or managed with proper blood sugar management. Depending on the type of diabetes, medication may be required to manage blood sugars and to protect the heart, kidney, brain, and other organs affected by diabetes. When it comes to managing constipation, though diet and lifestyle changes may not be enough, here is what to know about why it occurs more often in people with diabetes and what you can do about it. How common is constipation? Constipation can be defined as having fewer than 3 regular bowel movements each week. So in this case, that's the average. So the white race is quite okay, but for the black race, I would say more. If you could say a day to go to the washroom, then that's fine. So 7 times a week should be okay. It can be unpleasant and even painful. An older study found that constipation is more common in people with diabetes. It's estimated that about 60% of people with long-standing diabetes deal with constipation. Now, the next question is, what causes diabetes constipation? Damage to the nervous system is a known long-term complication of diabetes. High blood sugar levels from type 1 and type 2 diabetes can lead to diabetic neuropathy or nerve damage. Damage to the nerves controlling the digestive tract can lead to constipation, diarrhea, and incontinence. Poor blood sugar control over a long period of time may increase the likelihood and frequency of constipation. In addition to lifestyle choices and neuropathy, people with diabetes sometimes take medication that can slow gut mobility and cause constipation. Talk with your doctor about the side effects of any medication you take. Daily diabetes tip. If you feel stopped up from time to time, you are not alone. Recent research indicates that constipation is common in people with diabetes. Find relief by starting with natural solutions. For example, eat more fiber, drink more water, increase physical activity. Those could be of great help to you. If you don't notice improvement, talk with your doctor about moving on to fiber supplements, stool softeners, or laxatives. Treating constipation. Natural options. Simple solutions are the best place to start. Try increasing your fiber intake, drink more water, and getting more regular physical activity. All of these can help the digestive system function more smoothly. While starting with natural solutions for constipation may prove helpful, people with diabetes could find that this solution do little good if they are bigger underlying problems. Laxatives. Laxatives may also provide relief, but you should use them carefully. So what I'm saying here is there are also some setbacks when it comes to usage of laxatives. So that's my key concern here. For instance, you risk losing the essential mineral like the magnesium that the body needs. Just like you could lose also potassium. So all those things need to be taken into consideration. You risk even having cramps at some point. So that's the whole thing here. Before moving on to laxatives as a potential treatment, consult with your doctor. Some laxatives are not intended for long-term use. Your doctor may be able to find the least intensive treatment to ease your bowel movement. They may have you try osmotic laxatives, stool softeners, bulk forming laxative, and lubricants. So those are the 4 types that we need to get used to it and also be selective here because it risks creating you trouble down the road. Blood sugar management. In many cases, proper blood sugar management is the best solution for regulating digestion and constipation in diabetes. It prevents nerve damage that can lead to constipation no matter your diet and your activity. So the take-home message is while constipation can be a sign of poor long-term diabetes management, it could also be due to something as simple as not getting enough fiber. By moving from the simplest to the most intensive solution with the help of your doctor, you may find that your constipation can be managed with lifestyle changes and without the need for medication. So all these things, your doctor should be the ideal person to decide what is best for you. So do not for any reason start using any osmotic laxative without the consent of your doctor, because I've seen cases where people end up in a tough situation like I was saying before. So make sure your doctor is informed. That's the best advice I can give to you. Know which type of medication you are using and also find out the frequency, how they have to be used, and use them properly. Do not just use them without the consent of your doctor. That's the best advice I can give you. Once more, my name is Dr. WAN. Please do not forget to subscribe to my YouTube channel. And now I will just keep continuing with the second part of this discussion when it comes to constipation. Digestion begins the minute you take a bite of food and ends a day or 2 later with a trip to the bathroom. The whole process is handled by some part of your nervous system that controls other body's function that happen automatically, like your heartbeat and breathing. But over time, high blood sugar can damage the tiny blood vessels and nerves in your body, including your digestive system. So you see, this is what happened down the road. So make sure that your blood sugar level is being controlled, things are okay, check them as much as you can. A speed up or slow down of the process in your intestine can result in diarrhea or constipation. Diabetes medications, certain food and related illnesses can cause diarrhea as well. Nerve damage. About 60% to 70% of people with diabetes have some form of nerve damage or diabetic neuropathy. It can develop at any time, but the longer you have diabetes, the more likely it is. When diabetes damages the nerves going to your stomach and intestine, they may not be able to move food through normally. This causes constipation, but you can also get alternating bouts of constipation and diarrhea, especially at night. Misfiring nerves may not squeeze the muscles that mix and move the stuff in your intestine, so everything slows down. Your colon absorbs more moisture from the waste, which makes your poop harder and harder to pass. Constipation that lasts a long time can cause other health problems, such as fecal impaction, a hard lump of stool that blocks your rectum so nothing can get out. Fluid that lingers in your small intestine too long can also cause some trouble. For instance, allow too much of bacteria to grow. These could lead to bloating, belly pain, and diarrhea. Nerve damage in your large intestine may let fluid move through too fast or cause problems with absorbing and releasing fluid. If that is the case, your poop could be more watery and you will need to go more often and urgently. Now, another aspect here is medication. Metformin is the medication many people take for type 2 diabetes. It helps lower the blood glucose and makes your body more sensitive to insulin. But it can also cause nausea and diarrhea when you first start taking it or when you raise the dose. Those side effects usually go away a few weeks. Diarrhea is a possible side effect of other diabetes drugs too, including acarbose, cholesevelam, linagliptin, miclitol, cesagliptin, sitagliptin, and others. Eating a lot of sugar-free sweeteners like maltitol, mannitol, sorbitol, and xylitol can cause diarrhea. They are from a family of compounds called sugar alcohol. Because your body doesn't break down and absorb these completely, they pull extra water into your intestine. So you see how this diarrhea comes out of say, stool inconsistency. That's the mechanism. If you have type 1 diabetes, you are at a higher risk of having celiac disease. People with this disorder can eat gluten. That is a protein found in grains like wheat, rye, and barley because it damages the small intestine. Poor diet there's another factor here. Many people get diabetes because they don't eat enough of fiber, or they don't eat the right meal on the right quantity also. A poor diet can also make you constipated. Your body needs lots of insoluble fiber, insoluble fiber to have a regular bowel movement. You get this kind of fiber from whole grain, fruits, and vegetables. If you cut down on carbs to help lower the blood sugar, you may also be cutting out important fiber sources. Dehydration is another thing here that you don't need to joke with when it comes to this condition, especially when you are a diabetic patient. Also, you need to stay hydrated. Diabetes makes your kidney work overtime trying to flush out the extra sugar from your blood system. You have to pee more often, so that's another headache, another trouble here. You remember in one of my videos I talked about the symptoms of diabetes. So polyuria is what happens here. So these can leave you dehydrated. That makes your bowel movement harder than it should be, and your body has trouble getting it through your system. How to get things moving? Here is what you have to do. Your first goal should be to get your blood sugar under control. That can slow down or stop more nerve damage in your intestine. As it turns out, many of the herb choices that doctors recommend to manage diabetes will also ease complications. Eat food that is high in fiber, like whole grain, fruits, and vegetables. Get regular exercise, drink plenty of water. Fiber supplements can help deliver what you don't get from your diet alone. They make your bowel movement larger and softer so that they are easier to pass. Laxatives is another aspect here. Like I said in the other part of this video, that's also an important factor to take into consideration, and also be selective when choosing your laxative. We've come to the end of this lecture, and subscribe to my YouTube channel, ask questions, and I'm more than happy to help you. Thank you so much. I'm Dr. WAN.